Hi everybody, my name is Dr. Sean O'Mara. I'm a physician from Minneapolis, Minnesota, and the first performance optimizing physician in our country, and maybe in the world. I think performance optimization is going to be a very interesting and important specialty in medicine that's just getting started. And what I mean by performance optimization is using medical science and biology to help people perform better. So I'm using all the research that I've conducted for the past 10 years, what I've learned working with clients, conducting medical research, and looking at existing medical studies out there to help people to become not only optimized in their performance, but to optimize their health. What I found out, the most interesting thing and the most important thing that I found being a researcher for the National Science Foundation, where I received a grant to reverse chronic disease, is when you reverse chronic disease and you help people to become more healthy, they actually perform better. That's the really important leverageable asset to improving your health. So I come at patients from the perspective of my clients from trying to how to not just treat disease, but how to get people more optimally healthy. One of the criticisms I have with conventional healthcare and physicians in general is that they spend all their time, effort, and their livelihood, their revenues, are all connected with treating disease. So the end result is they make a lot of money for themselves, for the healthcare systems, insurance companies. But in the end, what does the patient look like? Their patients typically are in worse conditions after 2-3 decades of treatment in the conventional health space than they ever were when they got started. And I don't think you could just blame that on aging. Aging certainly does play a role in that. But if you concentrate on becoming optimally healthy, you slow down the aging process. Here's what I want to say to everybody. I get my clients to grow better, to become better, rather than grow older. And I do that by giving them what they need to learn to optimize their health. And part of that is what they need to follow. That means that they don't have to go to their physicians. They don't have to have blood tests to be able to do that. They simply track things that are around their body. One of the things that I'm particularly excited about is increasing blood flow. You increase blood flow, you improve performance intellectually, cognitively, and also to muscle tissue and to the organs. You improve overall physiology. So how patients track increased blood flow or perfusions by following their pulses and other interesting biomarkers that are available for free on your body. This goes way beyond just stepping on a scale. People can't get really healthy just tracking their weight. You could lose weight and actually become less healthy, or you can gain weight and become more healthy. It depends on the tissues. And so I help patients through all of my research that I've conducted as a physician researcher. We received a grant in 2016 from the National Science Foundation to reverse chronic disease. And what I found out in all my years of research trying to reverse chronic disease is when you successfully reverse disease from the human body, one of the best benefits that you get is you increase human performance. And that's why I'm a performance optimizing physician today. I'm a little different from a lot of other people too in my revenue model. I'm a not-for-profit. I take all excess revenue and profit that is accumulated through my efforts and I return it back into a not-for-profit and charities dedicated to researching performance optimization and optimizing health. And I like to return particularly those benefits back to the first responder community, the military community, which I'm a member of in the Minnesota Army National Guard, and to the marginalized in society that I think I would like to be able to work towards helping to give them some opportunities to improve their situation. So if this sounds interesting to you, or if you're an individual who just wants to get healthy, or ideally, you're the type of person who has maybe a position where your livelihood is predicated upon performance, I'm particularly interested in working with you. The reason is because I can tell you what needs to be done, and as long as it's credible, you're going to do it. I need to, as quickly as possible, help our country to identify the strategies to optimize the human frame that we can as quickly do and accomplish rather than waiting decades for long research. And what it takes are motivated people who will be willing to try natural strategies, nothing dangerous, to improve their health and improve their performance. I call these individuals that are particularly motivated that way alphas. So if you self-identify as an alpha, I'm really interested in hearing from you. But if you're just somebody who really just wants to start getting healthy, I'd like to hear from you as well. Thank you very much for your time.